Today I'll be talking on the sample collection for the corneal scraping. So to begin the collection, we'll be requiring some materials such as 21 gauge needles or kimura scalpel, then 2 glass slides, then the blood agar plate, then the saboret glucose agar plate, then the BHI, then CMB, thioglycolic broth, and the neutron agar plate. So in order to have this possible, the best possible chance of providing the clinician with an accurate diagnosis, any of these media is required. In some remote settings, some media may not be available, or there may be limitation in the variety of media, so it might not be possible to process. So for this situation, like you have to use saboret glucose agar plate, and also the liquid phase media broth can be which can be used is the BHI, and it is essential to inoculate in more than one bottle. So the procedure for this corneal scraping goes like this. You have to firstly inform the patient about the procedure risks and benefits and obtain proper consent before proceeding. Then also instill the topical anesthetic. Proparacaine is preferred over other anesthetic, as it is less bactericidal. So to begin, you have to align the patient in the slit lamp. Using a spatula, spoon or swab, you have to scrub the ulcer as at its base and at the leading edge of the infiltrate, as the greatest microbial use will be at this location. Then use enough pressure to indent the cornea slightly. If there is a concern for a fungal infection, the scrap need to be performed deep into the ulcer base to obtain the specimen. And if there is significant thinning at the site of the ulcer, it may be best to avoid the base and apply less pressure, so as to decrease the likelihood of perforation. It is also best to avoid obtaining only purulent material, as it is unlikely to yield a positive result. Now you have to transfer the specimen to the plate, spreading the material throughout the agar. So if you are also preparing slide, you have to place the specimen on the slide first and then the plate. So when preparing this plate, you have to avoid breaking the surface of the solid agar. It is convention that a corneal specimen is drawn on the plate in the shape of a C. However, this is not necessary as long as the plate is clearly labeled as corneal culture. So the specific pattern on the plates become very important if you are also collecting for the culture. If you are also collecting culture from the lids, from the eyelids, or from the conjunctiva. Now you have to rescrap the ulcer for each different plate on agar using a sterilized tool each time. A platinum spatula can be beneficial, as it can be heat sterilized between specimen and cools quickly. And then you have to label the plates, vial, and slides with information identifying the patient and the location cultured. So and also it should be tallied with the request form and the report form. So some of the culture media used are blood agar, chocolate agar, saboret dextrose agar, which is commonly used for fungal culture, then McConkey, then the brain heart infusion, then the cooked meat broth. In which you have to gently smear material on the surface of agar in C-streak, taking care not to puncture the surface of the agar. However, this C-streaking is not mandatory if you label your plates properly. So for the direct microscopy, you also have to prepare smear for direct for the gram staining, for the KOH wet mount preparation, for GIMSA, for periodic acid skiff, calcofluor, then Gomori modified methane amine silver stain, then the lactophenol cotton blue stain. So for the interpretation of this cultured result, the interpretation of the cultured result should be made with regards to the clinical situation, the adequacy of the sample, and the possibility of contamination by the organism present on the skin, eyelids, and conjunctiva. Sometimes slow-growing fungal infection can take up to 2 weeks to show positive growth on plates. Therefore, it may be necessary to begin antifungal treatment prior to receiving the culture result. If there is a high suspicion of fungal infection. Also, the labs will be providing like sensitive reports which will inform about the effectiveness of various antimicrobial against the isolated organism. So these reports are typically it will take like 1 or 2 days, or sometimes 7 days, or more than a weeks. So this is all about the sample collection and processing of the corneal scraping.